Good evening. This is Firebase. I'm Gary French. Friends, recently I was invited to be the MC at an event called Kentucky Stands Up. It was held at a venue called Beans Cafe and Bakery in Dry Ridge, Kentucky. The two keynote speakers that evening were Dr. Molly Rutherford from Kentucky, and then also from Ohio, an attorney by the name of Tom Renz. This event, to stand up, was encouraged by patriots like you and myself to understand what's happening in the world today. On tonight's program, you'll hear from Dr. Molly Rutherford, and you will be informed as to how you need to take a stand and know the truth on your health care.
So what I'm going to talk about is medical freedom. I'm sure, 5 years ago, most people wouldn't really understand what that means. I did to an extent, but I think we all kind of got slapped in the face with what medical freedom is not, right? Medical freedom is not being told that you can't go see your doctor when you're sick. That's insane. It's not being told that only emergency surgeries can take place in a hospital. It's not being told that you have to wear a mask, that you have to get a vaccine, all of those things. But the truth is, medical freedom has been eroded for many, many years. And not to bore you, but physicians and physician organizations, we played a role in that because when we started to accept insurance for payment and we started to bill insurance companies for the care that we provide for patients, we let go. Medical freedom was done at that moment because they got to dictate what we did, what they would pay for, and they basically, before that happened, it was the doctor, me, and the patient, and nothing in between. And then, of course, Lyndon Johnson with Medicare and then Medicaid, those programs were a big part of it as well. So once you have Medicaid, Medicare, and insurance in between you and your doctor, then your medical freedoms are impinged, and it's gotten worse. It got worse with the Affordable Care Act, and it's up to you as a patient to find other ways to get your care, to find doctors who don't participate in that mess. So what I like to say to people is, it sounds harsh, but I think if your doctor works for a hospital system, if your doctor works for the government, your doctor does not work for you. Period. That's the end. So if you're seeing a doctor who works for a hospital system, your doctor is not working for you. So try to find a physician who has separated themselves from that. And I can talk a little bit about how I've been able to do that. So I was born and raised in Virginia, and had you asked me probably in my 20s if I would ever move to Kentucky, I would have laughed. I had no idea I would end up here. But here we are. My husband, Chris, is here. He's in law enforcement. He's LMPD, so, we back the blue in our family. But we don't back the blue who would arrest you for not wearing a mask, okay? And I think that it was purposeful, trying to get rid of, a couple years ago, trying to get rid of good police officers, good firefighters, good people in those positions who would stand up to tyranny. That was part of the vaccine mandate, in my opinion. So what is medical freedom from a doctor standpoint? How does the doctor separate ourselves from all of that I just told you about? So in 2014, I decided I was working for a doctor who was independent, but he still billed insurance for care. And he was very enmeshed in what's called a patient-centered medical home. So we were trying to collect from all of the different Medicaid, what were they called? I've blanked it out because it's traumatic. But all these Medicaid companies in Kentucky, Passport, I'm trying to think of some of them. And there was a Humana one, Care Source, I think, and so they just didn't want to pay. And then I think what tipped it off was I got a letter from one of them saying, "You're overcharging these patients. You're billing what's called a level 5 code too many times. You can only do this twice a year for these patients." And I'm thinking, have you met your members? Because they're really, really sick. They're complicated. And then also, I only had maybe 5 or 7 minutes with the patient. I didn't have enough time to spend to address every problem. And I'm sure you've experienced this. You go to your doctor and you wait and you finally get back there. And by the time the doctor comes in, you know, they spend like 30 seconds with you and they're looking at the computer the whole time. And then they tell you, "Oh no, I don't have time. Only 2 problems today. 2 problems. You can't have more than 2 problems. I don't have time." That's terrible. That's not the way it's supposed to be. So I decided I had read an article about this model called direct primary care, because I am a family medicine. I did my residency in family medicine, and then once I moved out to Kentucky, I practiced in Carrollton, and I actually worked for a hospital system for a while. But it was rural, so it wasn't as bad. It wasn't as traumatizing. And then I became board certified to treat addiction as well. So I'm board certified in family medicine and addiction medicine, and board certification really means nothing. I'm not going to renew any of that stuff because you only need that if you're playing the game of medicine. If you're not playing the game of medicine, it doesn't matter. But anyway, so I decided that I was going to leave after I learned about direct primary care, and I opted out of Medicare. I do have patients who come to me who have Medicare, which is great. But I feel like I'm free from all of the conflicts of interest. So I no longer even have pharmaceutical reps come into my office, because that drove me crazy. It was really annoying to have them coming in and out all day long, you know, giving their spiel. They would bring us lunch, which was nice, but it wasn't really healthy food. So I call them if I need them. They don't call on me anymore. So that part is removed. And patients, the way that my practice work is patients pay me a monthly amount, and it covers a broad range of services. And then I have generic medicines in my practice. And so one of the reasons I was able to stay under the radar, some of my colleagues who were treating COVID early with hydroxychloroquine and ivermectin and so forth, many of them are fighting the medical boards now. Like, they're involved in all these battles. Many of them have lost their jobs. God bless them. I didn't have to experience any of that because I was just under the radar, because I was able to dispense directly from my office. So I ordered those medicines and dispensed very early and was able to help people. And nobody knew, because I didn't have to yell at a pharmacist, you know, like Mary Talley Bowden. Everybody know who Mary is? She's the best. So, you know, it was really great. And like I said, again, God positioned me to be able to do that. And I'm so thankful. And then, so we have the generic meds, and then we also do labs in the office, but it's, the charges are so much less. So if you go to the hospital and you need, like a complete blood count, for example, or some other lab work, you might end up with a bill. You'll at least end up with an EOB, which will tell you estimate of benefits. So what your insurance company paid for those labs, it'll be over $100 for a blood test that costs $3 in my office. So most people opt to just go ahead and do that because they really don't know if their insurance is going to cover their labs. And then we save people so much money on imaging. It's just obscene. I'll tell you a story. I had a patient who needed an ultrasound, and she said, no, just send it to Baptist in LaGrange, because my insurance will cover it if you send it there. And I was like, are you sure? Because I've heard this story before, and usually it doesn't go well. And sure enough, I think they ended up billing her insurance $2,000 for an ultrasound. She ended up coming out of pocket $800, where if I had sent her to a freestanding radiology center, it would have been $80. So that's what's happened. That's like we're all just being. It's just a big game, and I'm afraid that it's not really like the government is not the solution. So any politician who says that they're going to fix it, including RFK Jr., he says a lot of great things. Just don't believe it. I don't think they can. You just have to find doctors who are going to separate themselves from the system. And then, having said that, I do want to acknowledge that a lot of people don't even trust the medical profession right now, and I really get that. I'm sort of in that situation too, where I'm questioning all of these things that I learned during medical school, and now in hindsight, I can see that they were conflicted. Right? They were conflicted by the pharmaceutical companies. So, when the people who taught me medicine said, no, vaccines are the greatest thing ever. Like they've saved so many lives. They're so safe. All these people who doubt vaccines are crazy. They're out of their minds. They literally train physicians now to feel contempt toward people who don't trust vaccines. I can see it now. I could not see it then.
Stay tuned. Firebase will be right back.
And so there are so many lessons that I've learned over the years. You would think I would have known that, because I knew they were pushing, statin drugs on everybody. They were telling everybody, don't eat fat. Fat is bad for you. That's a total lie. As long as you're eating, real food, you can eat fat. Not seed oils, and that's a whole nother topic. But that was another thing that we learned in medical school. They would tell us literally statins should be in the water, Prozac should be in the water, all these pharmaceuticals should be in the water, and it's just wrong. So I understand everyone's sort of mistrust of the medical profession now, and so we're moving toward sort of a hybrid integrative medicine model at my practice. I've got a nurse practitioner who's working with me now, and she's getting certified in functional medicine, and so that's great. So we try to keep people off medicines. That's what we try to do. So when you're looking for a new doctor, some of you are going to have to find a new doctor now. And I can't take care of everybody. You want to find somebody who is independent from all of these conflicts. So look for the words direct care, direct primary care, functional medicine. Functional medicine tends to be a little more expensive, and I understand why now. A lot of the labs that they check are just more expensive. But it can be a very good thing. They can actually heal you so that you can get well, and then you don't need to go all the time anymore. Find a doctor who is a critical thinker. So somebody who recognizes what has happened, recognize that the pandemic wasn't even, that it was planned. It was a plandemic. So did everybody see Mickey Willis's movies? Okay. So I had the opportunity to work with Mickey on a project called the Global Health Project. If you look it up, it's globalhealthproject.org, and he was just fantastic. And we did some videos where we were trying to reach doctors who maybe knew what was going on, but and had made mistakes, and early on maybe they believed in the COVID vaccine at first. Maybe they believe that the hospital protocols were correct, and that hydroxychloroquine and ivermectin were poison, but they woke up at some point. And so we were trying to reach those doctors to feel comfortable coming out and saying, yeah, I made a mistake. And it turns out it's really, for some reason, doctors have a hard time saying that. So find a physician who is willing to say that, willing to change course, willing to say, I was wrong about that. Willing to say, even if they give you something and you have a reaction, to say, yeah, that's not the right med for you. Or even better, find a doctor who is really good at informed consent. So informed consent is something that none of us got with the COVID vaccine. Nobody got it, not even the people in the trials, it turns out. So what you want to hear is, okay, I'm going to prescribe you this medicine, and you want to hear what are the possible benefits? Why do they want you to take this medicine? And then you want to hear, well, what are the possible negatives? And then you want to hear, how could I, is there a way that maybe I wouldn't need this medicine? So, for example, like if you have high blood pressure and they hand you a medicine and say, this is going to bring down your blood pressure. Okay, doc, is this just going to make you feel better because you're going to see a lower number? Is there something I can do to improve my health in a way to where I don't need this medicine? And the answer is yes. So if they don't know how to do that, then they might not be the right physician for you. So just going on, I made an outline here. I do want to leave time for questions because I think this is important information. Is health insurance medical freedom? Who thinks health insurance is medical freedom? No, it's not. So most of us don't have a choice, or we're offered health insurance through our employer, and that's crazy, right? Why? It started back, I think, in the Depression era, or right after, when they employers were trying to attract people, and they started to offer benefits along with wages. But if you think about how much, I think I just read last week, the average premium now is almost up to $20,000. If you think about, wouldn't you just rather have your employer give you that in your paycheck? I mean, because you could use that to find a doctor like me, and then you have, I think, $18,000, $19,000 left over. You could put it in a savings account, and just have your own health savings account that you just keep for emergencies. That's another thing people don't really understand is hospitals will negotiate pricing with you. Insurance is what makes those prices exaggerated. So for example, I had a patient on Medishare. Medishare is a health sharing ministry. Are people familiar with those? Okay. So her husband had a catastrophic rare thing, like a splenic artery aneurysm or something, ended up in the hospital. And the bill ended up being $100,000. And it was 100% of it was paid by his sharing ministry. And that doesn't happen with insurance. She would have ended up with a $20,000 bill for that. So that's something to just point out. You have other options in terms of how to pay for your care, even if it is a hospitalization or something unexpected. But before Obamacare, before the ACA, we did at least have that option to get a catastrophic plan, a plan that was truly meant to be for unexpected. Because if you think about insurance, any other insurance, auto insurance, most other insurance, it's meant for auto insurance, for example, it's not meant to pay for your oil changes. It's not meant to pay for your tire rotations. It's meant to pay for, like, when your son gets hit in the parking lot at school 2 times in 3 months. So that's really how medical insurance or health insurance should be as well. It really shouldn't have to pay for your well checks, and we can talk about whether you need a well check or not, but that's another topic. It really shouldn't pay for those things. And even medications are not that expensive. I've learned that as dispensing them in my office. I have a medicine called lisinopril. It's a very common antihypertensive. It's called an ACE inhibitor. And if you were to use your insurance to get that, your copay at the pharmacy, it might be $3. It might be $10, but a month. But in my office, it's like 50 cents. So that doesn't sound like much because $3 now doesn't sound like that much to us, but it's a savings and it adds up. So a lot of my Medicare patients, I don't bill Medicare for my services, and they pay for their monthly out of pocket with me through savings from their meds. So like before seeing me, they would be they're on 5 or 6 meds. They would go to the pharmacy, pay maybe $150 a month. Well, $150 is less than what I charge them a month for their membership. So they're saving so much money in that way. And then the other thing I would say is just, try to be healthy, and then you don't have to interact with the healthcare system at all. Definitely try not to have to interact with any hospital these days. Like it's just learning what they did with COVID patients is just scary. And if you have a direct care doctor that's like-minded and understands what's going on in the hospitals, a lot of what, even if it's major, can be treated at home. So
stay tuned. Firebase will be right back. Welcome back. This program tonight went by so quick for me, and it just seems hard to believe that we're still talking about the healthcare issues and about mask mandates and vaccines, yet here we are. I want to take this opportunity before I give my closing comments to thank you for your tremendous support. First of all, you pray for us, and I really appreciate that. Prayer is needed in our nation and in our land and for our world today with all of the crazy things that are going on right here in the United States and what's happening with our political system and what's happening in Israel right now can give each of us a great deal of concern. But because you stand with us, we're able to put this program out on a regular basis on local television and radio and then on social media. Some years ago, a dear friend of mine asked me to consider and prayerfully consider starting a program like this. I had never really been in television. Of course, I'd been on radio and television with my preaching ministry, but had never done anything like this where I would talk about current events from a distinct biblical worldview. That dear friend is Pastor Bob Rogers at Evangel World Prayer Center in Louisville, Kentucky, and he asked me to consider doing this. Well, I already owned a coffee company, and I thought my plate was pretty full. My coffee company is called Firebase Coffee, and some years ago I partnered with another dear friend who had just retired from the Army, and he lives in Arkansas, and that's where we do a lot of our shipping of our coffee from, is from Arkansas. And you can support what we do by going online. You'll see it right there, firebasecoffee.com, and place the order. It helps support this program, but we also support other Christian causes, and we like to support veterans as well. Well, Pastor Bob asked me about this, and since I already had the coffee company, I had other people had suggested ideas and names for the program, but I just was very adamant that I would name it Firebase. And it's named Firebase not because of trying to create anything antagonistic. Firebase is an artillery term, which is the center of operations. And so with our center of operations being this venue coming into your home and your gracious kindness to invite us in, we want to always attack the lies that we're being inundated with here in our culture from a distinct biblical worldview. And I hold that Bible up. I have it here on my desk to remind me that's what we're about. And in the artillery, we target the enemies, with a forward observer, and we use maps and nowadays GPS. And so we would target the enemy with artillery to destroy the enemy. Well, here at Firebase, we like to say that we target the lies of the enemy by firing for effect with God's truth. Well, on this program tonight, you heard a lot of truth from Dr. Rutherford that was talking about the medical issues and the medical concerns and healthcare in general. One of the things that's surprising to me is that even some years removed from the pandemic, and you can believe it was planned or not. That's your choice. How dare we get into a society if we say plandemic, somebody cancels us. But the real issue here is not just a medical emergency as such. Everybody has medical emergencies, and everybody needs top-notch health care. I agree with that. But it should be your choice. You should choose whether to put a mask on. You should choose whether to be vaccinated. You choose whether to isolate yourself or whatever the case is. Because unless we think differently, we still do live in the United States of America. And the rights that we have been guaranteed to us by God Himself, not the government. Now, our government under the Founding Fathers, they walked alongside God. And so they came up with our constitutional republic. And it's with that in mind that we have Firebase, and we have people like Dr. Rutherford and even Tom Renz who will stand for the truth. Friends, I want you to know that knowing about the truth and actively living the truth are two different things. Until next week, I pray that you find God's hope and know that we here at Firebase stand with you. Thanks for watching this most recent episode. Click below the like button. Provide any comments that you like. Also, we will get back to you as soon as we can after you write to us at P.O. Box 39, Perry Park, Kentucky, 40363. Also, let us know if you like really good coffee, and we'll send that out to you as soon as we possibly can. What's the name of the coffee? Firebase.